fascinating session, Align, where we will be hearing the story of progress towards the elimination of onchocerciasis in Yemen. Despite all the challenges, the country is doing an amazing job to really advance in the elimination of this disease. If we can project the agenda, we can see how we will start first with a presentation from the Ministry of Health. Dr. Sami will walk us through the progress towards the NTD roadmap targets. And then we will have an interesting panel discussion with two of the main partners that we have supporting the Ministry of Health in the country. One is WHO and EMRO, and the other partner is the M-Fund, Professor Charles Mackenzie. We will then follow by questions and answers. Please notice that the questions and answers will have to happen through the chat. That means that you all can participate by posing your questions in the chat, and then we will elevate these questions to the different panelists and let them answer using their microphone and their video. We will also alert you that we have simultaneous interpretation into Arabic, French, Portuguese, and English. So please use the interpretation button in the Zoom device to be able to access these languages if you wish to listen to the presentation in a different language. And without further delay, I'm going to pass the floor to Dr. Sami to hear the presentation that he has in the progress of Yemen. Thank you so much. Dr. Sami, back to you.
Welcome everybody. I'm Sami Al-Haidari, NTD's director in Yemen. Ramadan Mubarak and Happy New Year. Special thanks for our colleague from Ghana for inviting us for holding this meeting. We will discuss with each other disease Sauda in Yemen. As you know, we have in the beginning we have the 34 million total population with the 333 district. Also, we have 41 districts in onchocerciasis and more than 700,000 population at risk with onchocerciasis. The co-endemic district with lymphatic filariasis 5 validated by WHO for elimination as a public health problem in 2019. Also, the prevalence confidence to the valleys running west to the Red Sea. The prevalence rate of clinical cases was over 16%. More than 50,000 are suffering from the severe skin disease in the worst affected valleys. Also, severe public health impact and socio-economical problem. When we can see the geographical distribution of mapping, we have 8 governorate with onchocerciasis in 41 districts. Here we can see the main valleys in Yemen or wadis. We have 7 valleys or wadi with the or including with the sub valleys. Started with the Wadi Moors, Sardud, Siham, Ruma, and also Zabid, and also we have Risyan and Mawza. Here we can see the classification of endemicity of district of onchocerciasis according to the guideline of WHO. Also, here we can see the black fly of Similarium riesiani in Yemen. The clinical picture, as you know, there is no research study so far stating that there is a cases of the blindness in Yemen because of onco or Sauda. But we have the cases rotation for epidemic will lead to the stimulation of melanin and secretion and darkening of the color and lead on the formulation of the area of melanocyte destruction and loss of pigment. And they will bring of the patient to the dermatologist with the phobia of phytolog. The skin shows asymmetrically and localized single big lesion on one leg, sometimes both legs, and sometimes one arm or shoulder. But the lymph node, the description of severe reactive from the oncodermatitis Sauda, also single limb, usually legs, is affected or localized part of the skin. The formal lymph nodes are considerable, enlarged from 2 to 5 centimeter long and from 1 to 3 centimeter wide. The description is not painful and not tender, mobile, rubber consistency. They called them Almam, the mother, believing that they are the surgeon of Sauda will go to the surgeon to remove it. The prevalence of subcutaneous nodules are very low and loss, not blindness, severe intolerable itching, black and white coloration of their extremities. Here we can see some picture from the some legs during the secretion or the secretion of melanin, and also here we can see the some nodule. When we talk about the time period of the Sauda disease in Yemen, according to the available data during the period of 1956 until 2022, the during the period 1956 until 2000, we have the according to the available data from our colleague for CSSW and the National Literacy Program, we have some cases were treated in specific area with the limitation potentially the treatment does not cover the large scales like MDA. Also, during the same period from 20, the expansion and district in all in 8 governorate during the period 2001 until 2013. But the same or the same is limitation and does not cover all target in valleys or district. In 2014, we benefit from the experience of Justice project in expanding and implementing. And 2014, we have a decision to establish the component of pharmacocerciasis under the umbrella of Manchester of Public Health special entities. In 2016, we started with the pilot MDA in 4 districts in 2 governorate, and we was started from 2018 with the end fund for the first round MDA in 33 districts in 8 governorate, and also in 2019, the Manchester decision was issued that approval the INCO component and the approval of internal and external advisory committee. What I means is that we used to meet the periodically internally and partially externally due to the lack of capabilities. And also in the same years, the implementation, the first part of entomologically and the parasitic survey to determine the epidemiological map. Also in 2019, we have the second round of MDA in 33 districts and third round in 2020. In 2021, implementation of the outreach MDA campaign and for epidemiological difference. I mean, we treated the target people in the district and we benefit from the drugs it was sent to end. In 2022, now action plan for implementation MDA in 41 districts, but unfortunately we have the faced great limitation so far that are still under discussion, the most prominent of which the drug that is close to expiring. The means reasons is that the validity period is only 2 years and mostly the less than that and the sense the I mean the sense from shipment of quantity until it arrive in Yemen take more than 9 months due to the closure of Sana'a airport. Also another reasons from Manchester of Public Health directive lie to distribution of the drugs or medicine in the health facilities during the current stage, and this contracted is treatment policy of house to house implementation. Here we can see the most prominent task of advisory committee, including the following, and we greatly need to benefit from the experience of African countries. I mean the yucca providing the technical and advice to the program in Incocercias elimination, and also is composed of national and international experts as well as Ministry of Health staff from the program. And also the committee will review the annual progress of the national elimination effort and update of Yemen Incocercias plague, which will be visually table color coded by focus according to the fourth stage of elimination with the guideline of WHO. Here we can see the most notable over the years during the period 2019 until 2022. In, as you know, in 2020 and 2019, the members of the committee were named internally and externally and benefit from the experience of some African countries. In 2022, the committee review the database and also decide the conduct the survey to determine the epidemiological map and also continue for MDA. In 2021, the implementation of the inductive campaign for the entire community to measure whether it can be applied during the coming years. In 2022, the committee decided to re-implementation of the survey and continue the camping or MDA. Here we can see the collaboration with the other partners. We have the partners, our partners from CSSW and the National Literacy Program during the establish the program, and we take the database with the Manchester Public Health, and also we have the WHO as a technical partner, and also it is the facilitate or coordination between the Manchester Public Health and the Mactiz Indonesian during the receiving of the drugs, and also coordinating with the other partners such as the World Bank, and also we have the end fund providing financial support in the field, the operation as operational cost, and also sponsor for periodically a meeting during the previous year. Also, we have the ISBIN as a technical support and member of the advisory committee, Special Dr. Daidir, and also supporting Yemen in one round, I think in 2017. Also, we have the Mactizan donation, provide the Manchester Public Health by ivermectin as needed. Also, the infinite, the mediator between the Manchester Public Health and the End Fund, and also the technically and financially support. The Ghana network with the Incocercias committee, community, and communication and advocacy. He, when we talk about the Incocercias control intervention, the stage of implementation, you can see as in the slide, the treatment was limited and target, meaning that targeting cases according the previous years was discovered or according to the presence of the patient, or because the most of them could not quit the facilities or teams if they were fixed, or this is the biggest challenges that we are seeing now. In the other hand, you can see from 2016 until 2021, the treatment included all residents in the valley from the 5 years and above in all endemicity district. Here we can see the during the period 2016 until 2021, Uh, I mean the number of therapists who have been covered by the independent during the 2016 until 2021 with the success coverage more than 18% for all stage. When we talk about the implementation of survey during the period of the 2019, the objectives of the survey investigation breeding site of onchocerciasis factor in the Western Governorate of Yemen, and also identify the prevalence of anti-OV16 IgG in the first line villages. Here we can see we have the 53 district with the criteria altitude at 200 until 1200 meter present of preeminent of the seasonal water course. Also here we can see the methodologist. As you know, we have the Western Governorate and Southeast Governorate and Eastern Governorate. In Southeast and Eastern Governorate, no mapping until now, because is disaster or under discussion. And in the Western Governorate, we have the exclusion mapping district that do not favor of transmission and classify the prevalence of anti-OV16 IgG4 in at least in one the first line villages per one district, and two less than 2% and more than 2% and more than 5% and more than 10%. Here we can see the main one from main valleys or wadis in Yemen, the Mawadi Mor, with surrounded by the three governorate and also classify the district for the more than 10 district and 5%, more than 5%, 10% and 5%, and also with the 2% and free from the endemicity according to the K. So here we can see the another main valley Surdud surrounded by the three governorates. Also here Siham and also Zabid. And also here we can see the Taiz valleys on surrounded by the two main valleys, Mauza and also Risian valleys. In summary, as you know, according to the result of the survey, the survey, we have the 53 district. The 53 district, 10 of district had previously found old study is in them, and they did not survey them, and approval them is infested. And I means we have now 41 district remaining, 10 of which are empty or free. I means now we have 19 district with negative reading site, 1 district of semilinium demonicium, and 21 of single or mixed semilinium. This map implemented by the third party chosen from the WHO in 2019. The limitation during the survey, the mapping was conducted during the dry seasonal only, and also the detection of anti-OV16 IgG4 was conducted using the IgG rapid test. Why elimination will be possible? The team are very active and have a good report with the population, and also the distribution of the drugs to times years for over 5 years has clearly a very positive effect on the prevalence of dermal onchocerciasis, and the disease appear to be restricted to nowadays, and also the potential site for larva killing are available in the dry season. The challenges, the politically situation of the country, and also the internal mobility and also migration and the availability of financial resource, and the drug expenses and exchange supply, and politically decision, and the difficult of the train in the target area special entomologists, and overlapping administration in solution and district. What we need or action needed for in 2013 and 2014: elimination mapping stage 2, exclusion the mapping, and MDA twice yearly, and management and evaluation, and also the capacity building special for GPS and the entomologist. Finally, if we want to talk about the credibility about the disposability and keep pace with achieving the goal of the globally by 2013, there must be really approach from all partners and provide clear plan and clear support. Will also that thing be transparent parent from the Manchester of the health about the implementation mechanism. Special thanks for all partners. Special thanks for the end fund support Yemen during the previous years until now, and also we have another partner from WHO, Mactiz Indonesian and Isbin. Thank you so much.
Thank you so much, Dr. Sami. That was wonderful. And you ended your presentation talking about your partners, and therefore we are going to give them the floor as well to give their perspectives. I think we have Charles Mackenzie with us representing the M Fund, and he's going to talk to us about the partnership that they have with Yemen and how they see the challenges and the way forward. You have the floor, Charles.
Thank you. I will share my screen, if I may.
Yes.
Hopefully. Can you see my screen okay?
Not yet.
It says start my video. Oops. Can you see it now, please?
Not yet.
That's a pity.
If you wish, we can also ask Nadia or Anne
Nadia
Francis.
has a copy, yes.
You can try one more time, if not.
I'm surprised.
Nadia, you wish to try and share your screen? Thank you, Nadia.
Okay. Thank you. So I just give you a few comments from the support from the Yen Fund. Welcome everybody, and thank you for being here. And so, for the next slide, please, Nadia. So very quickly, and because Sami has given us this, it was 1957 when Yemen was recorded as having this disease, Sauda, which was a skin disease. There were German investigations in 1982, mainly by the group led by Dietrich Buttner. And then the first treatment approach was really started by Yassin al-Kubati in 1994. So this was the only country in the world that was actually treating individual patients. That was carried on by Abdul Samad al-Kubati right through until the MDA. MDP were really the first supporters of the program and supported both the drug and some clinical and serological and entomological reviews that were done around about 2010 to 2014. Out of that came a national plan. And then, as Sami has said, the MDA started in 2018 with end fund support. Next slide, please. I think it's important to point out that one of the very special conditions about Yemen, and you'll see here maps that you've seen but from Sami, but the disease is in very tight and difficult valleys. And the question remains to us is how limited is transmission? We really believe it is limited, as Sami said, but that we really need to make sure of that in terms of not just this, but in surveillance. But as you can see, it's very much just, as Sami has shown, in very difficult valleys to get to. So that's a particular challenge, both to get to assessment, and really we need to keep that in mind when we think about how far we need to make sure that the OEM takes place, and particularly surveillance eventually. Next slide, please. So there's been support from the End Fund for the expert advisory committees, and we held those in Cairo. We have to hold them there because of the travel restrictions preventing people entering Yemen. It's also a little difficult to find places where we can get the Yemen team to easily get visas. So we've had two expert committee advisory committee meetings and other meetings as well with the team itself. They've attended the End Fund program committee meetings too, so we've managed to be able to connect with them very well. We brought EMFNet in, which is based in Jordan, which is a public health support program under Majid Al-Ghunai, who used to be, I think, high in the ministry in Yemen. He was high in the ministry in Yemen to help us as a conduit through to the program for funding communications, and that still exists. And just to say that in terms of funding, Yemen is very much on our program under the Reaching the Last Mile Fund program, which is supported by the President of UAE and Bill and Melinda Gates Foundation. So it's very much still on our list of countries to support. So the support for Yemen continues. Have the next slide, please. So, as I said, there's the support through EMFNet, and the aim of our support is to eliminate. So the support will aim at elimination. So that is our goal. We provide fiscal support, technical support through us and the meetings, us being particularly Daniel Wachi for entomological report support, and myself and others. We're currently planning a training support for entomology, because the defining of the breeding sites has not been done. And that's a key issue in terms of how far away from the actual water courses in the valleys that transmission is really taking place. And we're trying to set up at this point a training support, and we will continue to support the annual expert advisory committees. Have the next slide, please. So from the last expert committee meeting in Cairo, the continuation of MDA, as Sami has said, some OEM, not the whole country, obviously. we felt the most important thing was to work out where transmission was actually taking place. So breeding site mapping, and as I've mentioned, planned training of local teams to identify the breeding sites. One administrative point that we still need to work out, that the ministry has directed that MDA may need to change a little from the house-to-house approach at the moment, because the ministry in Yemen now requires that all drugs and all vaccinations, meaning all programs, not just onchocerciasis, but all medical programs to populations, should be carried out or distributed from health centers. And that's an issue that we need to discuss with the Ministry of Public Health and Population, and that we haven't done that as yet, and probably need to have that discussion with EMRO as well. So I think that's my last slide, I believe. So thank you very much, Maria.
Thank you so much, Charles, and thank you to the Reaching the Last Mile Fund for supporting Yemen. We also have a critical partner in the country that is WHO, and we have Supriya representing EMRO that is going to talk to us about the success stories, the challenges from the WHO perspective, and how she thinks Yemen is situated to reach the 2030 NTD roadmap targets. So Supriya, if you can kindly introduce yourself to the audience and share with us your points of view. Thank you.
Thank you, Maria. I am Supriya Varusavitana. I am the Regional Advisor, Neglected Tropical Diseases in WHO Eastern Mediterranean Regional Office based in Cairo. So Yemen is one of the countries, one of the 22 countries belongs to the WHO Eastern Mediterranean region. And we have only 2 countries endemic for onchocerciasis, Yemen and Sudan. And I can see in the chat also, there's a question about the cross-border issues with the Yemen for onchocerciasis. Yemen is the only country in Asia which is endemic for onchocerciasis. So Yemen does not have much of a cross-border issues related to onchocerciasis. Okay, going back to Maria's question to me, my questions to me, sharing the views of success and challenges of the Yemen program. The 2 presenters before me, they of course discuss about the challenges and also most of the part of the success. So I want to reiterate what are the success behind. I think we have seen in Dr. Sami's presentation that Yemen has in all the rounds of MDA, Yemen always reached the very successful program coverage. So I want to talk about what are the reasons behind in these success. This success, which will also very important for reaching elimination. Yemen has vast experience in conducting mass drug administration campaign targeting elimination of the diseases. Yemen started its first mass drug administration campaign for lymphatic filariasis somewhere back as 2002. And Yemen reached the elimination of lymphatic filariasis as a public health problem by 2019. And other than for lymphatic filariasis and onchocerciasis, Yemen also conduct mass drug administration targeting elimination of schistosomiasis, soil-transmitted helminthiasis, and trachoma. And when Yemen conducts mass drug administration campaigns for all these neglected tropical diseases, they reach always very high program coverage, always beyond more than 80%. And Yemen also proved already, in spite of having a very complex situation since 2014, the country can reach elimination of the neglected tropical diseases. Not only lymphatic filariasis, now currently Yemen is planning to eliminate trachoma by 2026. When we talk about the onchocerciasis campaigns, since 2018, Yemen has started conducting mass drug administration campaign. And you saw in Dr. Sami's presentation that all the rounds, they have reached the coverage of more than 80%. And when they, of course, so far they have conducted mass drug administration campaigns, not for the total endemic district, but for the target population alongside the wadis. But in 2021 February, Yemen conducted covering the total population in 4 districts. And in that mass drug administration campaign also, they have reached a very successful program coverage target. When they conduct the mass drug administration campaigns, Yemen plans it very well. They conduct, before each mass drug administration campaign, they train all the drug distributors engaged in these campaigns. At least they provide 2 to 3 day training for all the drug distributors. And then also while implementing the mass drug administration campaign, they have the Ministry of Health conduct very close supervision of the activity, and they also take remedial measures then and there when there are some problems. Yemen also have another interesting character when they're conducting the mass drug administration campaigns. They also engage 30 to 40% of female drug distributors. This is also very important to reach the high coverage when they conduct mass drug administration, because mostly during the daytime, the houses, the only females are there. So when they have the female drug distributors in distributing the drugs when conducting MDAs, they can reach a very high coverage. And of course, Yemen always has had a very strong support from the partners, and Dr. Sami and Professor Charles also mentioned in their presentations the partners' commitment. During the mass drug administration campaigns, Yemen engaged not only the health workers, they also get the support of volunteers and also the support of other sectors like teachers. So with all that support, when they conduct the mass drug administration, they have a very high coverage. So those are the success, the factors behind their success in reaching elimination. Because for the neglected tropical diseases amenable for preventive chemotherapy, MDA is a big tool which we use to reach elimination targets. I don't want to elaborate more on the challenges, because in the 2 presentations by Dr. Sami and Professor Charles, they explain well what are the challenges Yemen facing, mainly the political situation, the migration, and heavy donor dependency, difficult terrain, and insufficient technical capacity in some areas like in entomology and vector control. The next question Maria had for me was that where does Yemen stand in reaching 2030 NTD roadmap targets? I think in the chat also there's a question whether Yemen will reach elimination of onchocerciasis by 2030. Let's see where Yemen will reach by 2030. So Yemen started the mass drug administration in 2018. And so far they have conducted mass drug administration in only 33 districts, but also for the population living alongside the wadis, not for the total endemic districts. And in Dr. Sami's presentation, he mentioned that there are now 41 endemic districts. And they also have to again conduct the remapping to identify the total population which is having a risk of getting the disease, because the previous mapping, which was conducted in 2017 or 19, I think, it was not completed. So now they have that is the advice by the Yemen National Onchocerciasis Elimination Advisory Committee to conduct remapping immediately after the rain. So to see all I understand all the breeding sites. And then once they know the total target population, then they have to conduct comprehensive MDA for targeting all the population. So with these scenarios, by 2030, I think that Yemen may have a mixed picture in the country. Some districts still conducting mass drug administration. That is a phase 1 of the onchocerciasis control program. That is a treatment or intervention phase. And some districts may reaching phase 2, that is the post-treatment surveillance. So considering that, as per the roadmap target, by 2030, Yemen will most likely to be one of the countries that stopped mass drug administration for more than one focus. Thank you. Maria, over to you.
Thank you so much, Supriya. So let's see if Dr. Sami also shares this point of view on how they are going to be able to reach or not the 2030 targets. And in that line, I'm going to read some of the questions that our partners and friends are posing in the chat. And then we will give the floor to Dr. Sami to be able to address them. So I'm going to start with a few questions that are related to the mapping, and then I will go to some questions that are related to the MDA. So we have some colleagues from Ethiopia, Sindeu Mekasha Fedleke, asking how we think that with the mapping not being completed, if the targets we think the targets will be still met. And also we have questions related with mapping, asking whether, how you think if you conduct these surveys during the rainy season, how do you think this will change your results? There is also questions related to the survey. Some colleague from Yemen, I believe, Abdullah Wahed Al-Serawi, is asking how we think the results of the 2021 survey have implications on MDA implementation, how to interpret those. Another colleague is asking how do you interpret the fact that the larvae was found in these high altitudes, and what are the implications for the program? So I think those are the mapping related questions, if you wish to address them. Yeah, provide a little bit more detail on the mapping, provide a little bit more detail on the next steps for completing the mapping, on how you interpret the results from the high altitude and the dry versus rainy season. So Sami, you have the floor.
Okay, thank you so much. Dr. Ahmed, you can answer about all questions, please. Dr. Ahmed Thabit. Hello.
Yes, I can see him online, Ahmed Thabit. If you can unmute yourself.
Dr. Ahmed. Okay, anyway. Thank you so much for everyone for accepting the invitation to hold this important meeting, which comes as a part of serious periodic meeting organized by colleagues from WHO. We actually we are benefit from your opinion and suggestion and impact to strengthening of one of component of health system in Yemen in light of the challenges affecting in the health system. I have an answer about some question for my colleague. He said about he questioned about the cross border. We don't have any cross border in Yemen with onchocerciasis. Also, Dr. Abdullah Al-Serawi, Prof. Abdullah Al-Serawi, one of the members of the committee, support us. My opinion, me and our colleague, hope that the best strategies will be applied to elimination of onco, which is representative to collective treatment of the target twice per year, as Prof. Mackenzie said, in additional to insect control, capacity building, and completing the survey. I'm absolutely certain that if all this implementation, we will elimination of the disease in a few years. What we are currently facing is very big challenges in decision of the Minister of Health, as Prof. Mackenzie said, which represented is not implementation the strategy from house to house, the starting from this year's, not only in the INCO camping, but all MDA camping such as schistosomiasis, polio, measles, and others. And therefore, everyone know that this will not achieve the goal as required. I'm very clear with all. I will buy the price for that. Maybe lost my job. So if we want to succeed, we must all feel responsibility and work professionally, and supporting all partners should help us to communicating scientific fact to decision makers. Therefore, I say that if we want to continue to implementation, we have two options, and this may be personal opinion. The first option is for the supporting all partners to be explicit to their support the implementation mechanism with the decision maker in Manchester of Public Health to both the scientific and practical fact. Another option, the second option is to follow the mentality of the current Ministry of Health and continue to support the health facility with the medicine or ivermectin just only, and make them limited, although the most of them are very far from the target. We can take the advantage of this periodic in carrying out of the therapy and building the capacity until things change and approval for implementation that come from house to house. In any case, both matters are or under the discussion with all partners, and we are finally we are a soldier for implementation and the cooperation with to elimination of Sauda or onchocerciasis in Yemen. Thank you so much.
Thank you so much, Dr. Sami. And there is also a question around the coverage. In one of the slides, you have shown the number of people that are being treated every year. And Dr. Frank Richards from the Carter Center wants to understand better what is being your target population and the denominator that you are using. Because it seems that in some moment, the numbers go from 500,000 people to 300,000. So can you explain a little bit the population figures?
Yes, in the previous years before the survey mapping in 2019, the target we have 33 districts, as you know, with the target more than 500,000. The coverage in the same target, not all population in the district.
And how that evolved from year to year? Why there is a change from one year to another year? Because in some moment it seems there is a big change in the numbers.
Not the numbers the same for all years from 2018 until 2019, but the some years, especially for 2021, we have the pilot study for for all population in district according to the decision of the committee in the last meeting in 2021. And in the 2016 also we have the pilot study that changes the number, but the number before the survey we have more than 50,000, 100,000, and now we have 41 districts. I think is more than million population as a target.
Excellent. And there is also one question from William Brieger. He's trying to understand whether Yemen is using virtual or online trainings for training, monitoring, and if you are being able to successfully implement any virtual trainings.
You mean by the
online, by internet? He's asking in general for the program, whether Yemen can use online or virtual training to monitor, implement, etc. I guess he refers like if you have good coverage of internet in the country, if you are able to reach some of the areas that are more unstable through internet. That's what I'm trying to interpret.
VR support, we appreciate for that.
Good, thank you. And I cannot see more questions because I think the questions on the coverage, on how the MDA is conducted as well, they have already been answered. So I'm just gonna give a couple of more minutes to see if anyone wants to pose. There is one comment from Charles. I'm seeing it coming regards the directive of the Ministry of Public Health to only distribute from health centers. It needs to be discussed with the ministry, and then perhaps some changes that could still include the current field teams. Charles, do you want to make any comment on that, or is that? And we also have another comment from Chuku Makata. Can you share your experience in navigating the political, security, and challenges to achieve optimum therapeutic coverage? Sami, you want to address that?
Shall I just comment?
Yes, you can comment.
Yeah, I think we don't know yet, so I don't want to jump ahead about this requested change. But I think there are innovative ways that we can still use the field teams to be part of the distribution. But we still have to look into that. But I should say that the field teams are excellent at communicating with their the villages in the wadis, and I do not see us not using field teams in some way, whatever we have to do. So I would not take this as a negative at this point. It's just something we need to discuss with the ministry. Thank you.
Thank you. Dr. Sami, can you address the question from Dr. Makata on sharing more experiences on how you navigate the political and security challenges in your country?
Yeah, everyone, now we have 2 governorate, we have 2 Manchester, we have 2 deputy minister, we have 2 decisions. We have difficult, the political situation is very difficult for us.
Thank you. I am going to also read the comment from Frank Richards that he seems to recommend that the National Onco-Elimination Committee from Yemen should issue a recommendation to the Ministry of Health on the MDA versus the clinic-based, because he seems to think that the clinic-based MDA will not work to have enough coverage and stop transmission. So I think that's not a question, it's more a comment. So I think you can note that. And I don't see any more comments in the chat, so I will let you, Dr. Sami, let us know if you have any last comments that you would like to address to your audience so that we can close this webinar. And then I give you the floor to really address the final words to our audience. Thank you so much, everyone, for being with us today. And with the words of Dr. Sami, we will finalize our webinar today on Yemen. And I really want to commend your progress, really. I think it's impressive how much progress you have been able to make despite the difficulties. And I really encourage you to continue working hard to achieve the final elimination. Dr. Sami, you have the floor for the final words.
Okay, thank you so much for everybody, for every partner support Yemen from the previous years until now. We can go with either for elimination or see Yemen for elimination of onco-cases in the next year, inshallah. Thanks again for holding this meeting, and see you.
See you all very soon. Thank you.
Bye-bye.